I'm Magdalena, and this is my persuasive speech on universal health care. So, you have a child. You both have children. You're both parents. You understand this. You go to your child, and they're sitting there and they're writhing in pain in the fetal position, and so you take them to the hospital, and you find out that they have appendicitis and they need an appendectomy. Well, what do you do if you're underinsured? That's really expensive. You can't let your kid die. You can't have them be in pain. So you say, okay, go through with the surgery. And when all's said and done, you get a bill for $50,000. So, considering this story, my stepdad actually had appendicitis, and this was the bill he was looking at had he not had insurance. And this is where the need for universal health care comes in. In the United States, so many people are underinsured or don't have insurance. And the 31.6 million people in the U.S. of all ages did not have insurance in 2020. Of these 31.2 million, over 1 in 10 were under the age of 65. So that means when your kid gets appendicitis, when you're an 18-year-old and you can no longer be on your parents' insurance and you're stuck paying $50,000 just out of high school, you don't have $50,000. You don't have a job that gives you $50,000. All of this, and you're all on your own. Children made up 5% of those uninsured, which total 3.7 million people in the United States, or children in the United States. So, 43% of the population is considered underinsured. So not just the ones that lack insurance. 43% of the population is considered underinsured. 63% of the people surveyed by the Commonwealth Fund's Health Survey said they did not purchase health insurance because of the price of it. And 2/5 of those enrolled in insurance plans are considered underinsured. That means that $50,000 surgery, their insurance will cover maybe $10,000 of it. That's still $40,000 that they'd end up paying. It's all of these things where they add up one by one. So the consequences. 25% of people with chronic health problems do not fill their health prescription because of the cost. And 46 skipped or delayed healthcare because of the cost. Adults were 3 times more likely not to visit a doctor within the past year than those that were insured. All of this adds up to incredible statistics of death rate in the United States. It isn't the fact that we have a bad healthcare system. We have life-saving doctors. We have all of these things, but we don't have the insurance, and people can't afford to live. What are you going to do? Okay. Hospitals in rural areas. We live in a rural community. Salida Hospital is our closest, or Leadville. But hospitals in rural areas are forced to shut down. Many people are without medical care due to hospital closures. Like I said, Salida is a half an hour drive from here. An ambulance, yes, that might be more. Leadville's a little bit farther away. I remember when my grandfather got a heart attack, neither hospital was capable of performing the necessary medical procedures that would save his life. So he had to do a flight for life. Actually, he didn't because of the storm, but he had to go all the way to Colorado Springs, which is an hour and a half away. All of this leads to more health complications and more death rates because of this. The reasons hospitals close is people can't afford to pay their medical bills. And when people can't afford their medical bills, a hospital will foreclose because they don't have the funding. Whew. So hospital inpatient and outpatient care makes up almost 50% of medical billings, yet over half of the adults could not even cover 1,000 of those bills within the 30-day period. Okay. Countries that do it right. England covers all residents. It uses tax revenues to pay for healthcare. Employs or contracts directly with health providers to deliver care. So we have England, Australia, the Netherlands, and Taiwan. All of these places do their universal health care and do it in a way that it's affordable. If it's not necessarily free, it's affordable, and it makes sure. And all of these countries, I'm pretty sure, have a higher like life and death rate than we do. Like, we are way low on the like life expectancy, and part of that is thanks to the lack of availability in healthcare and the cost of it. So Australia, it has a public-private model. So all taxable income of those making over $15,000 a year gets a flat tax of 2% to pay for their health insurance for all. Usually residents pay no out-of-pocket expenses with limited copays based on income for prescription drugs. And private hospitals exist, which allow people who have purchased private health insurance to receive care in those facilities. That's the difference between private and public. So public is going to allow anyone to come because it'll be the nation's insurance. It'll be that government insurance. Whereas private, again, is that where they afford it. Okay. Taiwan government pays for the healthcare system in general. And the Netherlands show that a competition model works to provide universal healthcare. So all of healthcare is considered private market, meaning that everyone is required to purchase private health insurance, which again is like, it's not a universal thing. The government forces mandatory enrollment. If a person does not purchase private insurance with premiums about 20% higher than if purchased with government penalties. So employers contribute to the provided health coverage for children and to help with the cost of employees' insurance premium. So companies that you're a part of are required to help pay. Okay, so looking at what other countries do, this provides us a way of benefiting in the future. So the future outlook. Doing nothing will create financial hardships for residents in the United States. So some really interesting statistics. In 1970, it was $353 per person for healthcare. In the average of a person spending money on healthcare. That would have equaled $1,875 per person in 2020 dollar amount. So that different rate of how much the dollar was worth. But in 2020, so that difference, in 2020, $12,531 per person for healthcare. All of this is showing how it's going to keep getting worse. People are going to not be able to afford healthcare in general. So, hospitals charge more with private insurance than they do with patients who have public insurance. Without regulations and caps on procedures, prices have skyrocketed and are inconsistent. That means your life-saving procedure at one might be different at another, or the same type of life-saving procedure has different costs. For example, knee replacement has increased 74% between 2003 and 2016. Okay. The United States healthcare system is broken, but we can change it. So here's how you can help. Promote this to our congressmen. Congress holds Ways and Means committees that explore these issues and can impact how congressmen vote on these issues. Letter campaigns work. We could write letters. Exercise your vote. A lot of the good things about America is our say in how it works. And you're able to vote. You are both voting. You're of the voting age and past. And if you vote for programs and any things like that, you can help get it to where our country isn't on the verge of letting everyone die or no one being able to afford healthcare. Okay. With over 30 million people who do not have health insurance in this country and several millions more who are inadequately covered, healthcare in this country is costing many of its citizens their financial well-being, their health, and for some of it, even their lives. Every day, Americans are making sacrifices to pay for skyrocketing medical bills, using up their savings, taking on additional work, delaying buying a home or getting an education, or even losing their homes and have to declare bankruptcy. If we don't press our government to take a serious look at completely altering our healthcare system in this country, we will continue to face rising health costs and diminished services. As voters, we matter. Take action by promoting universal health care to your congressman, exercising your right to vote, and being responsible with your own health in order to lower health costs for yourself now and in the future. Thank you for listening.